Can you talk a bit more about weight management?
Weight training or strength training is key to weight loss because that is the engine that's burning. The more muscle you have, the higher number of calories that you're burning on a daily basis. Unless you're doing, a half marathon, you're doing a big long bike ride or snowshoeing, or where you're doing really calorie intensive workouts, generally working out doesn't attribute for a high percentage of the calories you burn. Strength and muscle does.
Resistance training versus strength training versus if I am a complete novice, how in the world do you start? I have a very special and very cool guest that I have been wanting to record for about, I think, 2 years. So I think we're finally here. Thank you for being a guest here, Vicki.
Thank you. This is very exciting.
All right. Before I usually let you start, but before you do that, just because you've helped me, I just want to say thank you. Thank you for being my go-to on solving issues I still deal with, like lymphedema. So firstly, thank you. And secondly,
yes.
How do you know so much about the space?
Well, I mean, I didn't really start off in breast cancer at all. I started off, I'm an exercise physiologist, and I started off sort of the classic personal training route, and got my training certifications and started off on a career in that area. Didn't find it very satisfying and really always wanted to get back to wellness. And I had kept up on my certifications. And, around 2007-ish, 2008, a friend of mine had a double mastectomy. And she is an athlete. And so I was out visiting her in Texas, and I started researching sort of exercise recommendations because she was asking, I'm having a hard time finding something beyond sort of the basic exercises. So I started researching, were there good breast cancer exercise programs out there? And there really wasn't anything at that time. There was, some basic things that different, organizations would recommend, but nothing, either for an athlete or somebody who was just getting into it. So at one point early in my research, I found a book that had been out of print. And it was really one of the few sort of exercise breast cancer books that was out there. I couldn't get my hands on it. And unfortunately, the woman who had written the book had passed away. And I just thought that was just so sad. And her legacy of sort of developing this great exercise program wasn't moving forward. And I guess I decided to put my stake in the sand and create something for women as a guideline for what they could be doing postoperatively.
And when did that start for you? How long ago?
I started doing my research around 2010. And then when I interviewed I work at the Peninsula JCC, I told them, here's what I'm thinking about doing. And they were very enthusiastic and said, yes, great, go ahead and bring it. So I designed this program, and then a friend of mine was a doctor at the local hospital, helped me get to present to the tumor board. So it was their breast cancer tumor board. And that's where I learned about the process. What they do is look at all the cases for that week and how they're going to be addressing those cases, from pathology to, social workers, physical therapists. They're all there in the room. So there I am presenting my, here's my program. I think I had, a little flyer. It felt like a Shark Tank. I was like, here's what I'm thinking about doing. And with no proof of concept, right? They it took a little bit for them to understand the concept, and the program started off slowly. We advertised within the center. And so a lot of the first patients were of Ashkenazi descent, and that was, it's like, wow, I have this program in my center. And then slowly but surely I made the contacts with various organizations in the area, all the nurse navigators. It's really sort of the gatekeepers that you're looking to get the information out to.
I don't think you said this, but can you spell out JCC for us? Just because I don't think people know
so it's Peninsula Jewish Community Center. And so there's about 175 JCCs around the country, and they're all varying size. We have affiliations with those. So, but some are managed they manage them themselves, or they have outside organizations manage them. But it's great. It's a community center. For us here in Foster City, we're really addressing the needs of our community at large in the Bay Area.
So then, Vicki, you started this in 2010. Just give us a sense of how many patients you've touched, and if you can share one or maybe two encounters that have been particularly meaningful, that would be great.
Yes, the program started in 2011, and we have touched we're about 215 women through that period of time. Some years were, sort of more robust than others. COVID certainly hit us hard, and we did have people that were working out during that time, but it was, we weren't getting any women were not getting in to get their treatment. So we certainly were not getting those referrals. So we're sort of building that back up.
Mm.
It's been interesting. But this last year we've sort of hit this record of almost 1,400 sessions in the course of 1 year that we've been doing. So that's been fantastic. And the women that I enjoy personally working with are metastatic patients. It's difficult because we know it's metastatic. So you're sort of having to deal with, what is happening at the moment. So I had one patient or client that had come in, and I started working with her, and she had experienced a little bit of back pain. It was just something that we were working through. About 3 sessions in, she had this excruciating pain in her back, and went in to find out that her Mets had gone to her back, and so she had some spinal fractures, and that just sort of stopped her right then and there. About a year later, she contacted me again and said, I'm back out of a wheelchair. She had been in a wheelchair. It was so debilitating. Had been working with a physical therapist to get her back into a strength area, and was looking to kind of get back into the training, and wanted to know if I would do it. I certainly, I absolutely said yes. So we started training, and she said, my goal, because I always like to find out what people's goals are, because I think that's important as far as the process. You've been diagnosed. It's like, oh, now what? So she had this goal of snowboarding. She wanted to get back on her snowboard, and I knew it was going to be a steep climb because she had these fractures in her spine, and they had healed, but it's a delicate situation. And it took us about a year to get her in the kind of shape, strength wise, to be able to try the snowboarding. Her doctor was like, yeah, okay, but just realize that, this is something that, there could be trouble, right? As if snowboarding wasn't trouble enough. I'm a skier, so yeah, snowboarding is a lot of trouble in itself. So, right. So she did it. She did it. And it was, there's this picture of her, at the top of the mountain, just the smile on her face was extraordinary. So that to me is like one of my, I would say it was my ultimate achievement, is helping her get to live that dream of what would be, in essence, one of her final wishes. I think, she passed away about 5 months after that. And the thing about working with somebody who is metastatic is it's sort of that their reality in those conversations. It's some of the most amazing conversations that I've ever had. We're with this person, and you really have to be present, because it's sort of like, these are the things they're dealing with. They are dealing with, I remember her saying, this is probably going to be the last year that I live, and that reality on a day-to-day basis. And what are you thinking? What are you feeling? And, you're just trying to work through the process. And it's very different for somebody who's metastatic, trying to get them, somebody who's metastatic into a physical space so that they can enjoy the time that they have, to me is one of the most precious things we could be doing.
I have a lot of friends in the metastatic community, and I think I just got chills. And in all honesty, I don't think I fully appreciated the emotional impact of movement.
Yeah, it's really powerful. I mean, it's powerful for everyone. And I think that level of achievement, another client that I was working with, she was, we had worked together and she was very excited just to be able to come to, we have a ladies' luncheon to celebrate our participants every year. And she was happy that she could come to that she could cook dinner for her husband, that she was getting strong enough so that she could cook dinner. And it's just these little things that really make their life absolutely, very, those moments very special.
Vicki, you mentioned goals and you mentioned achievement. For me, and it was going to be one of my questions for you actually, when I remember, so I got diagnosed during the pandemic. I have always been somewhat athletic, not, like weekend athletic, not like whatever the sports analogies are. Sorry, I have none. I've always done martial arts, and I do remember that once infusion was done, I had lost all of my muscle mass.
Mm-hmm.
And I remember one of my goals was to get back on the mat. And there was a point in time where I couldn't sit and stand. Like just getting off the couch felt like a feat. I'm young. I I think I could quote unquote bounce back quicker.
Mm-hmm.
But can you talk to us a bit about goal setting? When you're in the metastatic community, when you're in the early stage community, if you're Ashkenazi Jewish, you may not have been diagnosed yet community, how do you think about goal setting? How do you help someone come up with that achievable goal, I guess, is my question.
Right. And, everybody's got this sort of personal goal, or in some cases, they're so overwhelmed that they may not even have goals. So I try to really have them focus on maybe there are things that they want to change. Pre being diagnosed, I always say, you need to prep your body for whatever's coming your way. You just don't know what's going to come your way. The better shape that you're in now is going to help you when you're in chemo and all these other things, if you are diagnosed with cancer. So I say, you have to be sort of in ready mode all the time. And now you're diagnosed, let's say, right? And not everybody's in ready mode. I mean, I deal with this all day. I'm at a fitness center. Not everybody is ready to roll. But I think that the diagnosed are now, they are highly motivated. Now it's either maybe they're doing a restart. Maybe they've never been in a program before. They've never taken care of themselves. So this is an opportunity to restart. It really depends on where everybody is. If they're an athlete coming in and they want to get back to what they were doing athletically, their goals are going to be completely different than somebody who's never exercised at all. I also like to take a look at the whole body, because it's not just, what's happening with the surgical site. You're coming in with your knee and your ankle and all these things that, and we start with the feet. When I do evaluations, I have people walk and they're like, what has that got to do with, our looking at my body? And I said, well, it can throw everything off. It starts with the feet. As the feet are off, the knees, the hips, back, core strength, all those things moving on up are going to be incredibly important depending on the type of surgery you have, the reconstruction, the treatment in terms of radiation. All these things are going to come into play with what you're doing for your program. So I like to kind of keep it simple as far as sort of like, the nuts and bolts, and then build on that based on what the person is looking to do. And then they have those, hopefully maybe they have a reach goal. Or a place that they want to go. They want to go on a walking tour through Italy, or they want to be able to lift their grandkids, or they want to be able to, it's like, it's pure functional fitness, so we're trying to achieve and get them to come into a sort of a functional fitness space so that they can do the things that they love to do.
So maybe walk us through what functional fitness means. And then one of the new things I'm playing with, and don't ask me why, is what is a minimum dose of movement or exercise? And how do you think about those two things?
So, functional fitness, I'd say it sort of starts with flexibility, and I think that that's incredibly important for anybody who's had surgery because of the fact that you have surgery, and what I find is when you depending on, coming into the surgery, if you are on a computer and you're typing all day and let's say you have large breasts, and then you have surgery, you get sort of these rounding of the shoulders and sort of this internal rotation of the arms. And so what we're trying to do is make sure that the person is got flexibility across the chest, and we have, work on strengthening the upper back. But now also on your surgery side, you have scar tissue, you have radiation that's creating this sort of shrink, this constant shrink. And what we're looking to do is lengthen that out and making sure that that is supple and that you're flexible. And I would say that is something that I look at is in the first sort of step, is that flexibility. Because I also find that women, when they go through surgery, they'll come in and they're kind of holding themselves, or they don't even know that they're doing it. And so they're sort of in this protective, maybe it's a bent arm thing. Well, that starts to shorten the bicep. And so it really, and then it affects, starts going up the neck. So that sort of lengthening out and keeping flexible is really important. And then I also say for breast cancer surgeries is that I find hanging is really good. And so getting a pull-up bar in between the door frame. And so you're literally hanging, not all your weight, but you're just sort of doing this long lengthening out. And the very first time people do it, they're just like, it can be incredibly painful because of the scar tissue, and the skin. So that's just a constant shrink. It'll continue to go on unless you keep it sort of supple. So flexibility is really key because there's a lot of times there's a lack of movement. Let's say you're in treatment, you're not moving as much. Let's say you're not moving in treatment, then you're kind of doing the stiffening thing. So you've got to get up and get this sort of fluidity going, and movement is incredibly important, and flexibility is really key. And then depending on what's happening with your surgery, I mean, you may have the effects of neuropathy. So that might affect your feet, which is going to affect your balance. So then we kind of, I work on that next. If that's the scenario, we take a look at what's happening with their balance. Some people don't realize how they walk. Some people walk with a very tight stance, and then they wonder why they're constantly sort of tripping over their feet. And so it's a little bit like relearning how to walk and keep that more athletic stance so that they're not, and that's a tough thing to do. It's like naturally you're sort of going along and you're walking in a certain way, but so balance is really important. And then again, core strength, and this is something that you really need. And a lot of times it will depend on the surgery, the type of surgery. And if you're having reconstruction, if you're having, let's say, a deep flap, where you're cutting into the tissue, then that's going to create, sort of, again, this sort of bent over thing. Scar tissue, surgery, those things we're trying to offset with keeping yourself flexible. So core strength. And then I like to look at upper body strength versus lower body strength. Because again, innately, you may have come in with stronger legs and not a lot of upper body strength. So, I would like to work on upper body, again, especially focusing on keeping the back nice and strong.
That was a lot.
There's a lot. It's just like the tip of the iceberg. And again, it's going to be sort of nuanced to what you do. I've had women who come in who are horseback riders. And so they're wanting to make sure that they can have that stability that they had before with the leg strength. And because they haven't been on a horse maybe for a couple of months, it's like they're super worried that this is something that they really love to do. So it really, it's something that is so individual that if you're coming in and you're not meeting with a like professional who can help you out with this process, you kind of have to take a peek at it yourself and say, all right, what is it that what I do and what do I want to do, and then, we sort of build something, or you can build something around that.
Vicky, can I just make sure I'm understanding this right? So if I'm sorry, I think of me like a guinea pig.
Okay, super. Here we go.
Yeah, exactly. It'll be fun. I'm going to put myself back in a not so fun place, which is 2.5 years ago, where I didn't have any muscle mass. And sitting and standing was hard.
Right.
And
And how is it now?
Much better.
Okay.
I'm back on the mat. I'm doing martial arts. I had my tumor was in my, what is this called? The right armpit.
Yep.
So like
the right axillary. Yep.
Right axilla. So my surgery was inside the armpit. So they cut into kind of all of those muscles, including my, this is great. I can definitely speak today on a podcast. The muscle piece, this one.
You got your scapula, your rhomboids, you have your traps, you have a lot of muscles back there. That one.
There we go.
Yeah.
Mm-hmm. Many of those.
Yeah. You were having difficulty.
So a lot of times in the last 2 years, a lot of the first few months for me was like just basics, right?
Yep.
Trying to do just strength, the flexibility stuff. I was trying to do yoga. I tried swimming, walking, mostly self-driven. And then finally I hit a point where I did need a personal trainer. So I think I could do like maybe 20 minutes a week or something, just really tiny amount. But then slowly did resistance bands, then went back. And for the first time in my life, I'd never done this before, but started doing strength training. Started with like small weights, then added and kept going up and up and up. And I finally was able to just do like basic, I don't know, life skills, I guess.
Mm-hmm.
And when that started happening, I mustered the courage up to go back and try martial arts. And the first 6 months of martial arts was like, oh my God, I don't remember any of this.
Yeah.
And now I feel much more confident. I'm like, okay, I'm like almost back, almost fully back. I'm learning how to use my body again. It's different.
Very, yes.
But at least I'm I don't feel as traumatized is probably the best word I can think of.
Yeah.
Because I definitely had moments of trauma on the mat, because going back after cancer treatment was a lot. And I do Taekwondo, and Taekwondo head kicks are part and parcel of fighting or sparring. And anyone throwing anything to my head, and I had a panic attack. And I was like, yeah, that's great. That's a great thing to have when you're sparring in a sport.
Yeah, does not help.
There was a lot of psychological stuff too. So I'm feeling much better now. The reason I'm telling you my story is I'm sure our audience listening in is at very different points in the cancer experience. And I'm wondering if you could break that up into, if you were talking to someone in the middle of treatment who may not have the physical strength to even do a 10-minute walk, what do you say? Mm-hmm. If someone is just at the early stage, maybe at the tail end of treatment, transitioning into maintenance therapy or kind of rebuilding new normal, what do you say? If someone is a couple of years out, what do you say?
That 10-minute person, the key is to kind of keep make it realistic for you, right? Give yourself everybody should be giving themselves a little bit of a break, given that they're going through this. But I say not so much of a break that you're not doing anything, because you don't want to be static. You want to make sure that you are doing things. And that for let's say the beginner or the person who just feels completely exhausted, think of all the modifications that you could do, whether you're going to do a modified plank on the kitchen counter, so you've got your arms up and your feet are out and you're not on the floor, you're on the counter, or you're on the bed, or you're on, the chair. So you're just doing some of these modified exercises, but at a sort of kinder, in a gentler way. And build from there, but really kind of have a plan as far as, okay, I can hold this plank for, the countertop plank for 10 seconds, and kind of challenge yourself to bump it up a little bit more to 15 seconds. I feel that it's important to sort of push it a little bit more than you might normally feel comfortable. And maybe if you're not comfortable with it at all, you still have to kind of gauge out what you are doing so that you're making progress. Because if you're just doing the same thing the whole time, you won't make as much progress. And to keep yourself moving. For that person who is in treatment, it's really important for if you're in, pre-treatment or going into treatment is to do exercise. Your outcomes are going to feel better during the process. You're going to have much more energy. So I would say that walking is really key. And if you can walk, I say also include some hills. And if you need to have hiking sticks, I usually recommend hiking sticks, even if someone is on a flat surface. It's a lot of it is, again, if you've got neuropathy, then the balance is going to be an issue. A lot of people don't swing the one arm that's affected, and so the hiking sticks help to force you to put your hand out there and poke at the ground as you're going up. So that movement of your arms is really key. And so the hiking sticks it's sort of a hack for. Also, you're going to be burning more calories if you're using a stick, if you're climbing up or down. I mean, they're going to help you with on a lot of different levels. So sort of easy things that you can do. Do what you can do within sort of the parameters, because I feel like that is something that what do I do? Look at what you used to do. You can still do those things that you used to do. Maybe you're not doing them at the same level. And then for somebody who's out of treatment, exercise is something that is, I say it's the drug that you're going to be taking for choice, for life, because in some cases, if you don't have a drug that is going to inhibit your tumor, like a triple negative, there's nothing out yet. Exercise is the one thing that you can do. And so you really want to make sure that you've got an exercise program, anybody who's post-treatment, because the goal is that you're trying to keep, your lean body mass, as high as possible and your body fat as low as possible.
Why?
Body fat is something, and mostly lean body mass. Lean body mass is going to be the biggest driver or skeletal muscle mass of, the calories that you're burning. And so that's going to assist with you keeping for weight loss purposes. So you want to keep your weight at a healthy level. And it's not necessarily weight. BMI is something that is used. It's not used properly, height to weight, everyone comes up with a BMI. And it is really, we want to look internally. We want to see not necessarily the scale weight, because muscle is so dense. It's 75% water. And so as you gain muscle, if you're doing strength training, you're gaining scale weight. And so it's much heavier. So if you start training, you're going to be heavier on the scale. So it's not I'm at a healthy weight. I'm at a healthy size. You're taking a look at the clothes that you're wearing, so that you're looking at it in the appropriate way. So that's what I would say is in terms of the process a little bit as far as what you want to be doing.
Got it. Can you talk a bit more about weight management?
Weight management is really key. A lot of people come in. If you're in treatment, you may or may not have gained weight, and so the exercise is going to help offset that, increase your mood. It's going to just be a better overall. But as far as the weight is concerned, exercise, like everyone comes in and they do cardio. Cardio doesn't necessarily attribute to too many calories that you're burning in the course of the day. It's really only about 10%. So weight training or strength training is key to weight loss, because that is the engine that's burning. The more muscle you have, the higher number of calories that you're burning on a daily basis. Your activity is sort of on top of that, unless you're doing, a half marathon, you're doing a big long bike ride or snowshoeing, or where you're doing really calorie intensive workouts. Generally, working out doesn't attribute for a high percentage of the calories you burn. Strength and muscle does.
Okay, so if I'm a baby novice, which I was, for the record, when someone told me strength training, I looked at them as though they were talking, I don't know, double dutch. I can go toe to toe on like clinical trial data, by the way, but strength training? Oh God. Okay. All right.
Right.
Very, very intimidating. So can you just talk about resistance training versus strength training versus if I am a complete novice, how in the world do you start?
I would think about it as, strength training is you can either be using an apparatus, a cable or a pulley or, a TRX or a light band. That's the resistance that you have, whether it's going to be a weight. But start off with your body weight. Your body weight, you are the dumbbell, not you, but your body is the weight that you're moving through, space. And so there's so much that you can do with this weight that will still challenge your muscles. I mean, take, for instance, climbing stairs. If you're climbing stairs 2 at a time, that is it's an upward lunge where you're coming up. So that's really loading the leg muscles. I always tell people to work on their legs because they are such large muscle groups. You're going to make great gains in gaining muscle mass because they're long muscles. So legs are really important to do. Squats, because it's a full body, full lower body work doing a squat. A plank, and these are all things that it's basically your own body weight, so a plank. Now, as I said, modified, you can do it, think of it, it's on the ground is here, and then you can come up with any number of levels. You can be on your forearms or you can be straight arm. The thing with straight arm that I like is that we're trying to really keep that core of stability out. And so you're sort of building this base of support with the arms. I know that yoga is something that is great to start with, but that building that upper body strength, if you've just had this surgery, is going to take a little more time. So that's where the process is, where you're just trying to work through, a lower process or slower process.
That was super, super helpful. I would love to transition into physical therapy vis-a-vis movement exercise for a very selfish reason, which because you've heard my saga on lymphedema since, I don't know, 2 years now, Vicki?
Yeah.
What's it been?
Yeah.
So maybe let's just take lymphedema. I think it's one of the areas that I at least don't think there's that much information out there. I think the information out there is not great.
Yeah, it is not great. And for those of us who experience lymphedema, it's definitely something that it's a bit of a process. The lymphedema is basically swelling that occurs, if you've had any number of nodes taken out. The nodes are little mechanisms that are going to help move the lymphatic fluid through your system. And lymphatic fluid is right underneath the skin surface, right? So you've got about over 700 nodes throughout your body. Some are bigger than others. And if you take a node out, let's say you've got the sentinel node when you have your surgery, and then 1 or 2 downstream, now you're at 3. Backing up or blockage can happen because now you've taken that mechanism out by which to move the lymphatic fluid. So lymphedema occurs depending on the number of nodes. It could be in any number of areas, right? So you may get it sort of down the side, or you may get it in the armpit or in the arm, or all the way down to your hand. And the treatment, if you're going to go in and get treatment, so there's a couple things. There are things that you can do yourself, which I highly recommend everybody who falls into the category of those who may get lymphedema or maybe looking at lymphedema to be aware of those things. And then there's things that you'd want to go to sort of an expert to go and see because it's something that it's a little more exaggerated. The first thing I would say that you want to do is that you want to learn breathing techniques. And breathing is going to help on a lot of levels. It's going to reduce, so you don't panic, right? You're like, oh my God, what's going on? You don't want to stress levels bring up the cortisol in your system. And it's very hard to clear out. And so the swelling can occur. It can be increased, or inflammation can be increased because, again, you've had these nodes that are taken out. And so your lymphedema could be exaggerated by the stress. So the breathing technique is, it's like dragon breath, or the sort of fire breathing that you're doing, where you're taking a big, deep breath and you're distending your stomach and then exhaling and moving that sort of thoracic area back and forth. It acts as a pump. The thoracic duct goes through the diaphragm. And so by moving in this sort of breath work, you're sort of massaging that duct. And that's one of the main ducts. That's the largest lymphatic duct in your system. And so it helps to kind of, again, prime the pump and get things moving. So I say that the first thing, if you're experiencing lymphedema, is to work on the breath work. If you've been taught by a physical therapist or somebody you've been working with, the brushing techniques as far as moving the fluid up, that would go, I would do that second. And maybe you're going to do some exercises, simple sort of squeezy hand above and below. I saw one video where they recommended doing, the sort of squeezy hand, and then the chicken dance. I was like, wow, okay. So it was like, yeah, these physical therapists are all when they're doing the chicken dance. And I thought, it looks very effective. Whatever it takes to kind of get the fluid moving, do the chicken dance. Another thing that we do, or that I recommend, is getting a little trampoline. And so that movement on the trampoline, not like the high flying, you're taking your feet off and touching the ceiling. You're just keeping your feet on the trampoline itself and creating this pumping action. Again, it helps to move the lymphatic fluid. You could do that, 4 or 5 times a day, as much as you can stand. I call it tramping. That's tramping. Get on there and start tramping. So tramping. Now you moved into more of the sort of modalities that can help with the lymphedema. The standard is a very, I know a lot of women out there probably have them on there. It's like this tan colored lymphedema sleeve that they fit you with, and it's super, pretty. It's thick and it's heavy, and it's like I don't know. I won't go into the details, but it's just not. It's not a great look, and it makes you feel like you are you're sick.
Yes.
And so it's a constant reminder, I'm sick, or there's something wrong with me, or I'm which I think is the hardest part, because you feel, you can feel a little bit defeated. There's a company, that Lymphedema, that has really cool sleeves and gauntlets is the hand part, and I know a lot of women that have to literally have this on at all times. So you're kind of going into treatment that's a little more of an everyday treatment. So maybe you're having to keep, for someone who's got a chronic lymphedema, they're keeping the sleeve on. They might have a compression machine that they have at home. There are very expensive machines that you can get specifically for it, or you can get a lot of things on, Amazon. The Hyperice makes really good machines that are going to help with moving that fluid back up into where it can flush out of your system.
Thank you.
The one thing that I like is just one more thing, is the KT tape, and that is something that I just started researching. I was wondering why KT tape wasn't used for lymphedema, when it's really, that's what it's intended to do, is sort of raise the skin a little bit and help with that healing process. When you see athletes wearing this sort of tape, it's support and this sort of movement of the lymphatic fluid. Well, it really is a perfect application for breast cancer, for lymphedema, especially if you have a sleeve that's not, sleeve is going to come up to here, but maybe I experience all my lymphedema above my shoulder, down the back of my arm, and on my side, which I do. So I sort of started playing around with taping and, how the tape stuck on. And then I took it back to my physical therapist and said, okay, here's what I'm doing. And she's like, yeah, that's great. And so I find that there's more, when I first started doing it, there was not a lot of application of KT tape in sort of the physical therapy world, but I feel like it's a little more acceptable now.
I tried it.
Yeah.
And it was pretty good.
Yeah.
It was pretty good. I switched actually from the sleeve to the KT tape.
Yeah.
And I think we met in November last year, and that definitely helped. So I am so grateful, because it was also honestly so much better when you're exercising.
It's so much better.
The sleeve doesn't breathe.
Yeah.
So if you're exercising and you start sweating, it actually kind of gets very, I don't know.
Yeah, and the good thing about it is that you can keep it on for, until it peels off for 5 days. I mean, you don't want to keep the sleeve on at night, so you can keep this on, and it has a great effect. So I think it's a great I think it's great advice.
Vicky, you and I can keep talking as we know. I'm watching the clock and I'm like, oh, we're almost there. So maybe let's transition into rapid fire. So I'm going to ask you a handful of questions, short answers that we usually will clip up and disseminate them in different ways. So, what advice do you give to a newly diagnosed patient with early stage breast cancer?
So breathe, right? We're going to go back to the breath work, is sort of take a deep breath and start thinking about, I say, get organized. I think that your planner and the pathways that you guys are creating is something that helps, because it's so overwhelming. How do I keep track of all this? It just seems like it's mind boggling. I mean, suddenly you're in this position. You didn't realize you were in this position. So I'd say take a deep breath and think about, like, what is your game plan? How can I be organized? And part of that organization is finding out, what your network of support is going to be. And not everybody has a good network of support, but this is no time to be shy. So you really need to be an advocate for yourself and to get aggressive with your self-care and taking care of yourself. And by taking care of yourself, it is something that, maybe you were the one that was like always the person that was doing, taking care of everybody else. You've got to switch it to allowing other people to help you, because I think that is also something that can be hard for people. It's like, you're in a vulnerable position, and I think it's hard to ask for help, So I think that is something that is you just have to kind of not be shy and figure out what your network of support is and kind of get that organized. And don't be afraid to talk about your cancer. It's something that you should feel comfortable. Don't be shy. Again, don't be shy about it. It's just be open. Because I know that people have a hard time. They don't know what to say. Yeah. They're sort of like, well, how do I help? Right? What do I do? Don't be alarmed by the fact that people have a hard time talking about it. So maybe if you can, or if you feel comfortable, just let them know how you're feeling.
Vicki, what advice do you give to a metastatic breast cancer patient in treatment?
It's basically the same thing, but maybe your plan's going to be a little faster along its lines. Your plans are going to be completely different, because there's a time frame by which that all could change depending on how you're responding to the drugs. It'll go in chunks of time for, maybe this drug's going to work for 2 years and this drug's going to work for 2 years. And physically, how am I going to feel during those chunks of time? And so it really accelerates that hyper focus on exactly what do you want to do, I say that in sort of this kind way, but it's literally, what do you want to do with the rest of your life? Because we know that it is limited.
Yeah. Vicki, thank you so much. I am walking away having learned something, as usual. Thank you for all the advice you've given me for the last 2 years.
Yeah,
and for helping me deal with my lymphedema. And thank you for being a guest on the show.
All right. Thank you so much. Have a great day.
This podcast, show notes, and newsletter is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or any materials linked from this blog is at the user's own risk. The opinions of the speakers are their own and do not represent the opinions of organizations they're affiliated with, nor do they reflect the opinions of Mantacares Inc. or Mantacares' sponsors.